Welcome. I'm Dr. Jessica Evert. I'm the Global Medical Director of Child Family Health International. It's so great to have you here. I know there's a lot of folks that are going to be trickling in. And I wanted to preface this with the foundation that, we planned a webinar today about decolonizing global health, and that was over a month ago that we planned it. And in the interim, there's been a lot of shifts in the US. Policies and approaches to global health and global engagement. Last week, we had our faculty development workshop in collaboration with the AACNU, which is the largest higher education organization, and also with CISG, which is the Center for Global Health located in Costa Rica. And there was a lot of discussions around what's going on in the US right now. And so we want to offer a gathering space as well as discussion of how to decolonize our work. Many of you are familiar with Child Family Health International. It's a nonprofit organization that was founded by Dr. Evelyn Jones when she was a med student at Stanford. And the premise that she founded it on was that going abroad during her education, she noted was much more valuable for her than it was for the communities that hosted her. Yet a lot of the opportunities that offered were in the vein of people going from the US to help lower resource environments. So she created CFHI to be more authentic and really decolonize from our inception. We've grown over the past 30 plus years, and we have teams across 10 countries. Some of our global team members are here this evening, and looking forward to their comments and thoughts and perspectives. We have almost 20,000 alumni at this point, and we get a lot of accolades for our work, both for the transparency, but also for our ethical and other programming. Just to kind of co-locate on where CFHI is working, our office is actually based in California. Our central leadership team straddles the United States and Costa Rica, and we have global team members in 10 countries and teams on the ground providing immersive experiences throughout Latin America, Sub-Saharan Africa, and Asia. I have the privilege of representing the organization this evening, and I want to name that I am representing a huge team that really does the heavy lifting. I'm really honored to be able to represent our team, and here are some of the folks that are on our team. Carlos and Gonzalo are here. They are part of our team in Argentina and Bolivia, and look forward to all the perspectives that are brought to this discussion. Global health was defined in the Lancet in 2009 as a field of study, research, and practice that placed the priority of achieving equity and health for all people, involving multiple disciplines and really merging both population-based approaches and public health with individual-level clinical care, promoting interdisciplinary collaboration and emphasizing transnational health issues and determinants. On the heels of that definition were models for educating students and about global health. And this is one out of graduate medical education in Canada, which really emphasizes the global health trainee or person on the pathway to expertise. The white petals are different roles. They will serve as collaborator, communicator, professional, scholar, advocate, manager, all the different ways that we grow our trainees in terms of formal and informal curriculum and mentorship. But the outside circle, which has all the values and principles that this effort is based on, including health equity, social justice, solidarity, reciprocity, responsiveness and accountability, respect, honesty and openness, humility and sustainability, are really the values that drive us and bring us together as a community. So we are in a moment of uncertainty, and we wanted to create a space to discuss what we're all facing and approaches that individuals and institutions are taking at this time. CFHI did release a statement yesterday around some of the beliefs that we have and some of the foundations that our work is based on. These are some of the points that we emphasize in that statement, believing that human life is sacred and equally important, regardless of the geographic location of that life. That we believe in a very intentional distribution of health resources that's cognitive of disparities, inequities, social drivers of health, indigenous traditions, and sustainability. that we do believe in global health and international development, and that although these have had colonial elements, these elements need to be recognized and unlearned and refined. But withdrawing from global engagement is not necessarily the ideal solution. We also believe and invite critical dialogue in global health, and our curriculum reflects that, and I'll share a bit more about that. And so these dialogues are important, but we do believe that the world is a better place when the United States and other nations engage collaboratively and don't isolate. We also believe that grappling with complexity, nuances, and building partnerships is essential. We believe that we all benefit from diversity and curiosity, learning from each other, finding points of connection, and practicing humility. We don't believe that differences are a threat, and we believe that the aperture to growth, learning, and celebration of differences is a foundation for our world. We also believe in planetary health and that the planet requires protection, care, and thoughtfulness. In the last 2 weeks since January 20th, there's been a variety of moves by the US government to shift their commitments in terms of global health and the overall government infrastructure. I summarized some of them here, including the US exiting the World Health Organization. Our funding did make up 16% of the World Health Organization budget. USAID programs were halted, including PEPFAR, which provides antiretroviral treatment for hundreds of thousands of patients. There were layoffs, and President Trump has commented that he believes the USAID is run by a bunch of radical lunatics and that he wants to get them out. There has been an agreement made with El Salvador to imprison persons from any nation, including US citizens, particularly violent offenders, in their terrorism confinement center. The US has withdrawn from the Paris Accord on climate change. President Trump has stated that the US will take over the Gaza Strip and either temporarily or permanently displace the Palestinian population. The president has stated a goal of shuttering the Department of Education and having completely decentralized educational systems. He has dismantled diversity, equity, inclusion initiatives across the federal government. Federal governmental workers have been offered a buyout to quit their jobs. He attempted to suspend federal grants and payments, which currently has a stay. He also had an executive order to end birthright citizenship, which also has a stay by a judge and will continue to be debated in court. I wanted to ask if there are any other shifts that are on anyone's minds right now, if you could put those in the chat function to share any shifts that have happened since January 20th that are center of your world, either personally or professionally. You could share those in the chat. Any other shifts that need to be added to this list? Thank you. The US has pulled out of the UN International Court System, CDC, Medicare, trans erasure, birthright citizenship. Thank you for that. Looking out of pulling out of UNESCO. Other countries have followed suit. Carlos is here. He's our director in Argentina, and Argentina also announced that they will follow suit and pull out of the World Health Organization. Mary White points out the tariffs that were being levered on Chinese goods and the threats to tariffs on Mexican and Canadian goods. Thank you for that. So as we kind of gathered this evening, well, this evening for me, it may be morning, other times of the day for others, I want to have some community norms for our discussions and conversations. These are some that I'm suggesting, but they're certainly open for other considerations. Some of the community norms that I would like to have is valuing diverse perspectives, recognizing nuances, recognizing that two things or more than two things can be true simultaneously, respect for all members of the community and conversations, and the concept of step up and step back. So individuals should be actively contributing to the conversation and should, when dominating the conversation, step back to make sure everyone has a chance. Are there any other community norms this evening that would be helpful? You can put them in the chat. Okay, thank you. So we're going to go into breakout rooms. We'll have about 5 to 6 people per room, and then we will grapple with a few of these questions and then come back to share out. The first question, and maybe take a photo of these, because I'm not sure you'll be able to see them in the breakout rooms, but how is the current shift in US policies and engagement affecting you? What actions are you considering taking in your institution and life to voice your perspective or to react to the current shifts? And how are you working to sustain your programming and global engagement? So I'll ask that Madeline will divide us into breakout rooms and we'll spend about 10 minutes discussing and then come back and share out perspectives that come out of the breakout rooms. Thank you, Madeline.
I'll share something that was said. Tabitha talked about how we could turn to faith communities to help with this. And then another person shared that can we turn to like the state government to try and help with some of the things that still need to take place despite the government not supporting anymore. But I loved the faith-based community idea.
Any reactions or comments to those ideas or other sharing that came out of your discussions?
One term that has been very popular lately is shock and awe, right? It's like they're using that to create this feeling of uncertainty and fear, right? And something that came out at our group is that universities are taking a very careful stand. They are not reacting still to, I mean, yet to the changes that are happening in the United States right now. They feel they are going to be affected, but they don't know to what extent and how. One of the fears, of course, is deportation of families and probably students. You know, that is a fear. And besides that, well, two of us are not American, and changes are affecting other countries as well, right? Argentina in this case, but Bolivia is not because we don't have any cooperation from the United States government. So in that sense, that independence is keeping us safe because whether they cut the funds or shut down the programs or whatever they do, it is not going to affect us at all. I mean, probably to certain extent, some NGOs, but not in the functioning of the health system in general. So at the moment, we're just looking at things from, just the news kind of perspective, saying, oh, this is interesting.
Yeah, I think it's an interesting point, like the level of dependence that countries had on the US. And we're going to talk about colonialism, which really kind of segues into this discussion, but the level of dependence and or the culture and ethos around how the health system is built. When I've been in Bolivia, Gonzalo, I was really struck by the sense of national pride and really looking inward and being self-sustaining and having a strong human rights framework for health. And, you had an indigenous president for a long time and just how that has informed the approach in Bolivia versus, in East Africa, our partners in Uganda who are a PEPFAR site. PEPFAR doesn't just fund and supply the medications is really for NGO health systems in East Africa. It's much more expansive in terms of like foundational funding for all the operations. So those folks who have relied on the US are in a lot more vulnerable position. Other thoughts, comments, or reflections on what's been said or what you discussed? Colette's here and she's from a student government. I wonder, Colette, if you might share a little bit about from the student government perspective, how you guys are approaching things.
Yeah, hi everyone. So as a student in student government, I know that we are kind of facing the idea that we don't want to take a strong stance with our university. The university will not take a political stance, but we have been encouraged that there are organizations to seek out, and then also seeking out counseling services, which our university does offer for students, which has been which is really important for students. But a lot of students are struggling with a lot of questions, particularly around like funding, and how that will affect their stipends, and then how their status or their parent status is going to change. So I know there's a lot of uncertainty on the student side and trying to navigate how we encourage students right now in face of uncertainty.
Can I add two? We had one participant who described how what is going on is challenging her career plans in public health and global health, not knowing what positions might be possible, what funding, what practices, what infrastructure might remain at the end of the day. I think if we had time to brainstorm, we would find that there has to be something, whether or not we call it the same things and sort of categorize these enterprises as we do today. But there's no question some engagement in health needs and healthcare provision around the world has got to continue, whether it's under the State Department or something completely different. But I think for students now, the uncertainty, it's got to be shattering. If you had set your heart on this career path or this major in school or whatever, or you're in the middle of a dissertation in something and suddenly the ground is knocked out from under your feet. I get that. And I would hope that in the months to come, there will be some ways to even brainstorm and start thinking productively about not wasting that training, perhaps rechanneling it in some new ways.
Thank you, Mary. Madeline, I wonder if you could speak to some of your thoughts and comments on that that you were sharing.
Yeah, I think just to like put it in perspective, I just finished a Master's of Public Health and I go to the George Washington School of Public Health in DC. So I think it's a really interesting place to be. And having just graduated, I know a lot of my peers are wondering like, what does public health look like? And especially like global health, and being here, seeing so many kind of conflicting opinions on two issues, and just like also navigating like a lot of misinformation and trying to kind of like, we were taught in school how to like argue with fact and data and evidence, and like seeing that like large databases are going away, just like you cannot find online, and like that is incredibly disheartening. And I think there's so much truth in like these jobs will always exist, even if they are under another name or they're through NGOs versus the government. But I do know that there's like a lot of my peers who are wondering like, is there a job for me? And is it now, with thinking about like the amount of people who are like losing their job due to government shifts and things like that, like how competitive will these jobs now be, and how like am I going to be able to do the work that I actually want to do? So it is a struggle bus, but I think it's nice to know that there are so many people working in these fields and having positions who have gotten through similar occurrences like this in past history and kind of are still advocating. So
Yeah, and I think from a CFHI perspective, it almost seems like offering globalized opportunities and global engagement is an act of some degree of resistance and taking a stance. We work with a lot of universities, and one of you commented on the difference between public institutions and private institutions, and we're seeing that even private institutions, it depends really, like currently it's much more dependent on what state you're in now than it has been in a long time. I mean, Matt, you're here from Texas, and I know we spoke earlier today, and you've been dealing with this for quite a while in Texas. So I don't know if you have lessons learned for us, but just if what state you're in and what type of institution you're in becomes much more deterministic on what you can say, do, et cetera, how to navigate that.
Yeah, thanks, Jess. I mean, I was telling our group, I mean, the Texas has been living in a post-DEI world for well over a year now, and has been living in a world in which kind of academic freedom has been under constant fire for quite some time now. So I would say we're largely innovators in this new universe. That being said, the way that we survive, I think, is by focusing on everything that is within our sphere of control and sphere of influence. I think the politics are the politics, but the partnerships, the people, the communities, the relationships they go beyond any of that. And I think what we have been trying to do is remain good partners to those who we work with here locally, in South Texas, and then in around the world to the best of our ability. Be the best versions that we can be, and train our students that engagement sometimes means you've got to weather some really rough times, and then you have, like, the way that you advocate is actually through action, and by doing the work. So writing a blog post, amazing. Writing, getting on social media, awesome. Writing your representatives, great. But getting down and being with people who are at the margins and caring for those populations and meeting them where they're at and validating them and being in solidarity with them, is the best form of resistance at this time, right? So we're pretty muzzled, I'd say, in our state institution. I think you can't do it. I see Vanessa's question. I think you can't do it beyond whatever funds you have available to you. So, we've been very fortunate to be able to raise money for the work that we do in the community. And we have donors that are willing to support the work that we do. But it is far from a perfect model. So I'll stop there. But I think, the reality is, and I don't know what it looks like. I'm pretty dismayed by the dismantling of the USAID. That's, in many ways, we've been critical of USAID for many years, and there's been it deserves some critique in some areas, but it's largely a very big U.S. subsidy. So it'll be very interesting to see what we're going to do with those piles of grain that USAID pays for and ships around the world. But it's I think, to your point, Jess, I think the systems are very great, but the people and the populations are those who are in need. So we must be in, I think, allyship with them.
Yeah, and I think, there's not a lot of people listening to facts that have power right now, but the fact that, like, I don't know, upwards of 80% of USAID funding actually comes back to US-based corporations, and this is not like a completely altruistic at all, really, endeavor. I also worry, Bethany brought up, she's our director of health and safety, and she brought up at the top of the hour, like, that she's concerned that this will lead to less ethical global health engagement. And I do worry that people are going to be like, well, any going abroad is a good thing, at least we're engaging, and, that some of the quest for rigor and the progress we've made in the last 2 decades to, like, point out the nuances of how you engage, may be overlooked, just in the vein of, like, anything's better than nothing, kind of attitude. I don't know if anyone thinks about that or has that concern.
I'm making this up, Jess, right now. But what I think is going to happen is plenty of other markets are going to fill the void we leave behind. And there's going to be lots of Russians and lots of Chinese and lots of others in the global South now. Let's hope CFHI is able to continue in its clinical sites, even when they're surrounded with, funded by, dominated by folks from these other countries. Maybe that's an opportunity for us to continue to build bridges. Who knows? It would be very different, but it's a different kind of opportunity. And the interconnectedness is just going to multiply. I would also hope that instead of talking about global health as something having to do with tropical medicine and low and middle income countries, that we start to talk about world health. It's just healthcare. everywhere, and it takes different forms and different skills. But if we could integrate what we now separate out in Western medical education anyway, and make it much more clearly part of the curriculum and the training experience, maybe that'll help. I don't know.
Yes, you wonder if the language has to shift from global health. I mean, it should, right? It's really health equity wherever that needs, wherever inequities exist, which is everywhere. Yeah, I think that's really important. And I think it actually segues nicely into a bit of Tabitha, go for it.
Sorry, just as you were transitioning, this may be an interesting perspective, but I was speaking with my dad, and my family is Nigerian, and I think we're talking about the why behind it. And I think, we were just looking at it from different perspectives, and my dad was just saying that, like USAID and all of these organizations are really important, but then he was also like, maybe it will push countries, maybe like outside of the US, to maybe seek partnerships in an interesting way. So maybe like educational institutions that, or maybe NGOs that did have relationships that were now cut off, can, maybe there's another route that relationships can still be sustained. Yes, they may be limited funding, but at least that connection is still there, and with whatever resources that are had. And that's why I brought up the idea of faith institutions, faith communities, can support, whether universities in Africa and Asia, Latin America, wherever. And so we were just talking about different things of like, maybe this would give the opportunity of the countries overseas to reach out, or maybe still maintain the relationships that they once had.
Yeah, and I think, there's a real question here of whether this will lead to more self-reliance and actually more locally led and sustainable in terms of not reliant on external funding as much. China has long invested in sub-Saharan Africa, focusing on infrastructure with a focus on access to rare resources and processing of those resources. And they haven't been much in the health space. But many of the Middle Eastern countries have been in the health space. Many of the other countries have been in the health space. So yeah, I think there's certainly an important discussion to have around, number one, if the US can change this quickly overnight in 2 weeks and just, pull this funding, are we even a trusted partner anymore? Like our democracy / republic, voted, 31% of people, I think, voted for Trump, and many people didn't vote at all. And so the way that our elections work federally, if this can all be destroyed, taken down overnight, are we a good partner? And is it just like a wake-up call that maybe the US shouldn't be relied on? And I know that's super sad and there's a lot of grief around that, but I guess the question for the group, what are the upsides of not relying on the US federal government? And Tabitha, I think you brought up, that there'll be innovations and new partnerships. And I think about like low cost engagement, like COIL, which is virtual online international learning, and those models that don't require travel. But like, I guess I don't want to be too controversial, but like, what's the upside of this happening?
I would say that a big part of why people wanted him to be our president and why a lot of the country is supporting him is because they are looking forward to that separation of government from your private life. However, the way that it's playing out, all of these decisions are affecting individual private lives, but it doesn't seem to be affecting those lives of people who want that separation. So it definitely comes down to like a root belief of what is the role of our government. And so that's what we've already seen within the past month. And that's what we will likely continue to see over the next few years. And overall, I want to believe that everything will level out and be okay, because that is a cycle of the government. And one of the good things that is coming out is there are a lot of people paying attention in a way that they haven't been, for the past 3 years. So usually what happens is an election, then there's like, a lot of news stories and drama, and then inauguration, and then what are they doing in their first 100 days? And people kind of like go back to their day-to-day lives until the next election. And I feel like with the level of extremism that is going on, I want to say that one benefit will be that these emotions will linger for a longer amount of time and lead to hopefully a better outcome that we may not see right away, but we can lay a lot of seeds down for the future.
I love that point, Rochelle. That's a really great point. I would also say, I mean, the debate about international aid as an enterprise has been it's been in development circles since the 1950s. So what's the role of aid and how should it work? And Dambisa Moyo, about 15 years ago, she's an economist from Zambia, and she wrote a book called Dead Aid, and her book was basically about it was a screed against aid, basically being a form of meddling and a form of basically a form of soft, I mean, call it soft diplomacy, but it was basically, it was used to mobilize support to allies and to mobilize friendships. It also, so many things can be true. It also was a mechanism to save lives, humanitarian assistance through USAID, HIV treatment, HIV diagnosis, the administration of PEPFAR, the implementation of many PEPFAR funded programs through USAID is actually going to kill people, right? People are not going to get access to life-saving medicine because of a very quick and poorly thought out withdrawal of the aid. So you can debate all day long that, maybe the aid should have been there, maybe it shouldn't be there. How should it be more effective? But nobody, I think, in their right mind would have ever thought that it was a good idea to withdraw aid, even if we are in a dependency situation, because it will kill people. And the fact that it was done, affecting so many lives, not only of the people who've dedicated their lives to service of USAID, but also people who have now depended on that support for life-saving treatments, is for me quite cynical. And that's for me one of the more dismaying parts of it. But good part that can come from it is as others have said, I think I think there will be other sources of funding. They may be more locally grown, and there will be perhaps less dependency in the future, but it shouldn't have had to happen this way.
I think it's important we do our best to understand who it is we're dealing with, because these two people, I should say, who are making these decisions, they are not thinking as we do. President Trump, Elon Musk, they had no regard, not only for the recipients of aid, but for the tens of thousands of Americans who are serving around the world in making that aid available. Same with the freeze in this country. There was no regard for who would be hurt. The Lutherans, is it South Dakota, where the Lutheran aid services are doing not just refugee settlement, but nursing homes? These are Americans who are going to be hurt. To realize that, when we had that terrible plane accident a few days after he eviscerated the FAA, the blame was put on DEI hires, categorically characterizing anyone with any diversity attribute as being of inferior intelligence and skill. This is playing into people's intrinsic biases of all kinds across the country. sort of validating them, encouraging them. This man, Mr. Trump, is invested in social division. I'm sorry to go on like this. My question for us is, as we seek those connections that are so characteristic of CFHI, that are the life of the organization and also the necessity of the organization for it to be effective, we're going to have a huge obstacle as this division, as our society in the West is divided deeper and more quickly and more radically than we ever imagined. The language that's being used now, the disregard, we are no longer thinking as humans in relation to other humans, but as our guys and the enemy. And most of us are likely the enemy for some of the leadership right now. I just think we need to recognize what we're up against, see it clearly, so that we can figure out our strategies to work around it and keep some of the values that started this whole conversation tonight alive.
Thank you, Mary. Carlos.
Well, hi everyone. I'm from Argentina, and we have a president. It helps a little bit with this thinking about this country. Actually, we talked today with the student about 2 hours about the future, about what's going on in the world, and Argentina now is an experiment, but probably tells us something for the near future. The president of Argentina said that he became a president to destroy the state. He is the president to destroy the government of Argentina. Okay, he eliminates all the ministry, many offices of the government. It says like the first enemy of the people is the state. It's Argentina. And also he said like the guys that does not pay the taxes, it's a real hero. So it's like if you do not pay the taxes, you are a hero. And because it's if you have to pay taxes, if mandatory by the state, you are actually living in a communism system because your country is taking your money, the state or the government is stealing, okay, your effort. So it's doing that to put the corporation, to put the huge companies and other interests on the table. So that's kind of what's going on in Argentina. Is destroying Argentina. The president want to destroy the currency, also the pesos. They want to shut down the central bank. So it's a big experiment, but it tells something about these guys. Thank you.
Thank you for sharing that. Renz.
Hi everyone. So I just wanted to share since I'm from Canada, so we're neighbors to the US, and how we've been seeing all of these events unfolding. It's really like a circus because a lot of the things that the president has done in just days after taking office. We've just seen it, very negatively. And, even with our retaliatory tariffs that we've done, we still don't know what these impacts are because, the president saying that, this is supposedly going to be the golden age of America. And so I think, for us on the other side of the border, we're hurt by all of this. But for me, especially in our department within the Dalalana School of Public Health, we've had to it's really impacted our budgeting. We're working on global health research right now in the Philippines, but a lot of these things have actually directly impacted us. So, we've just been really disheartened by this situation, and and it's something that we were kind of predicting already, but with the events unfolding, and we didn't really expect the true extent of who would be involved, what actors would be involved in this whole process. When we saw, Elon Musk, and his team at Doge just breaching the US aid, we were just, appalled by it. And so it's something where, we've just really seen this as, like a circus. It's like it's something that, it's sad to say that this is happening, but we're really sad how it really affected our research, the work we're also doing in the Philippines. Like we've had to stop it temporarily, but we're standing in solidarity, with our values, and it really represents, the values that CFHI has also been upholding, just empathy and consideration for those who are suffering, and I think I like how you put it earlier, Mary, how a lot of the ideas, the political ideology that's in the air right now, we need to look at who it's coming from, like what their perspective is. And, Elon Musk, President Trump, I think President Trump maybe thinks he's still on The Apprentice right now, but, we're really at a time where we have to, just see who are these actors influencing our governments. And, I think we need to have our own worldviews and perspectives, standing in solidarity with those. And I think that that's the best retaliatory measure that we can actually offer. And from the prompt earlier about what are the upsides for this, all of these events happening right now, I think it gave a lot of these countries a chance to actually understand, what budgeting is actually needed to actually establish these programs, and what Matt has said earlier about realizing our dependence. And so I think, as sad as the situation is, countries have actually had the chance to actually think about what would happen and how they can actually plan for it in the future. So, even in this negative situation, a lot of our organizations are thinking about, what's 20 years down the road, how can we recover from another event like this? And so I think right now it's a temporary thing that we're seeing, in the US, and how it's cascading effects, in the global South. We've seen that, but I think it gives us more of an opportunity to actually think 20, 30 years down the road, how can we improve our health systems, our public health systems in our countries, and so that we don't have to rely on, independence from other countries. And so I think that's one of the things we can take away from all of these negative events just happening right now. So
Thank you so much. I reflect on, I'm from Ohio, which is in the Midwest. I lived in San Francisco for 15 years. I moved to Idaho. And the last 5 years in Idaho has been a huge awakening for me. This state has the mentality similar to what Trump and Elon Musk have in terms of less government, and government is evil in almost all forms. And it was very hard for me. It still is, because I've always been a part of societies that saw the utility of government, and I see the utility. Like, I don't think libraries can be privatized. I don't think roads can all be privatized. Like, I think public education is important. I think healthcare has to be coordinated and has to have a government component, because disjointed, privatized healthcare and insurance that's siphoning profits off ultimately leads to worse health status. But I've also noted that as individuals, many of the people that I work with and my patients in Idaho are the kindest, most loving on an individual level and caring about other humans. And it's this huge disconnect for me of like, how can you be so kind and caring on an individual level, but yet not see the role of governmental systems and societal systems, and a shared humanity that these systems are based on. And I guess this has been a good runway to the current federal situation in some ways, but I still grapple with how people can care about one another face to face, but not care about the other in a macro, population way.
Yeah, Jessica, I think about that a lot. I think especially because I'm from New York City and now I'm a third year medical student in Philadelphia. So everyone's perspective is shaped by their experiences. And so if you are from a major city where you have had a lot of exposure to diversity, you went to school with them since you were, 5 years old, you like went to, like you grew up with them. I feel like it kind of molds you in a different way than when you have not seen a person of color from the small town that you're from, which is some people who I know right now. And that's definitely important to put in perspective because one of the reasons that there is so much talk about these DEI initiatives is I feel a true lack of understanding of how DEI works and how it brings people who would otherwise be disregarded, although they are fully qualified. And then it kind of makes me think about how President Trump is 78 years old. And Ruby Bridges, the little girl we learned about in school, who was the first person of color to be integrated into public schools, she's still alive and she's 70 years old, younger than the president. So it just kind of puts into perspective of like who these people are and what their lived experiences have been and what their beliefs are. And I can also say, like, for example, about government aid, if you come from a family that has used government aid and we're able to not rely on it anymore, and we're able to see your parents get jobs that they were able to support themselves on, you're going to have a different perspective of government aid than the person whose parents were getting food stamps and unemployment and use that as a crutch to stay home and not work. So it really depends, like, with the environment that you're in and what you see. And those perspectives are very difficult to change unless you have those conversations with individual people to try to get them to see your perspective and where you're coming from because they have never been in those shoes. They have never had those experiences. So with the comment about the plane crash, like, and how DEI was the first thing involved, people who live in these places really do believe that if you see a person of color, they will look at them and wonder, did that person really deserve this spot, or are they just a DEI hire? Whereas if you know and you've been to these competitive places, every single person has very high test scores. Every single person has had amazing, like a resume, but they still would not have been allowed in because there are seats that go to, multi-generational donors, things like that. So it's all a combination of like what people know and how, again, our education system is very disjointed. So people may not even be able to see everything of the reality.
Thank you for that, Michelle. That's beautifully said. Can I just say, I have in the last week or 10 days seen a couple of op-eds and articles out there basically saying this sort of liberal project was a mistake, that humans don't have common ground. We don't share. We are categorically different populations, different demographics. And the effort to unite us and share an opportunity is mistaken. These are articles that are trying to justify DEI inequities and other inequities, be they colonization, be they racism, be they discrimination of every kind. I'm just saying, watch for these because they're starting to get out there and it's very scary. I think we need to be prepared for that and have some rebuttals ready.
Thank you, Mary. On that, I'm going to respect everyone's time. There's a lot more to discuss, and CFHI will be continuing to convene spaces. We didn't get to explicitly talk about decolonization, but I think we talked about decolonization, and I really appreciate all the contributions, the candidness, the vulnerabilities, and just know that, we do have a shared humanity, and CFHI is committed to persisting and creating those priorities. Thank you so much.